It's Sherry here from Eldritchy Stitchy. I hope you're all doing so well. The weather is beautiful here still, thank goodness, although I think we have some storms coming in, so that'll be exciting. I'm just going to do a nice mellow stitch with me today, so let's go ahead and just get to it. So things in this part of Florida have been going better, I guess. I mean, I know DeSantis has opened up a lot in our area again, which is nice. I mean, it's nice. It's a little worrisome because I think we're all still trying to make sure that like we're doing the right thing and we're keeping everybody safe. And I mean, I know the joke of Florida is just kind of like we do whatever we want, but I think we're, a good group of people who's just trying to do the right thing as much as we can. I mean, I like to think that about everybody. I like to imagine in general that people are doing the best that they can and no one actively wants to cause harm to another, but I could be wrong, I don't know. I mean, I guess not no one. There are psychopaths out there that do actively cause harm to others and want to do so too. I don't know about, like, others, but I definitely enjoy learning about serial killers. There's a psychologist on YouTube, Dr. Grande, who does really nice, thorough analyses of serial killers, and I really enjoy listening to him. He's got like such a mellow voice in the first place. He's just very nice to listen to. He's got a pretty dry sense of humor from what I can tell, and I really love his case conceptualizations. And obviously we don't, or we try not to diagnose anybody online, because you really can't diagnose somebody without having sat with them and interviewed them and spent copious hours really getting to know them. I mean, I know we tend to have to diagnose in the first session, but even still, like, our initial diagnoses can usually just be, rule outs and things like that. So, but yeah, I really enjoy the subject of serial killers. I think they're just a fascinating lot. Probably not a population I would ever want to work with. I appreciate the clinicians who do. That is certainly out of my depth of practice. So, but with me, I really enjoy working with like anxiety and trauma, and I've been taking a CEU actually on attachment therapy, or essentially it's emotionally focused couples counseling, but it's kind of grounded in attachment theory by Bowlby, and I really have been enjoying what I'm learning, and it's so interesting because, like, as a clinician, I think especially as a younger clinician, you do the best that you can as a clinician with what you know, and you only know so much, like, and you don't know what you don't know. So, like, as a clinician, when you learn new things, you'll look back sometimes on cases that you've worked on before or clients that you've worked with before, and you'll be like, oh, I get it, or, oh, I wish I had done this differently. And I think, I'm kind of in that situation now. I can think of one or two clients where I'm like, oh, I wish I had done more of this attachment-focused style of counseling with them. I think they would have benefited more from the counseling process if I had taken this approach with them as a clinician. And I've kind of come to, and I think just it's through time and whatnot, where you learn, like, again, like, you can only do the best that you can do. And I think, the core of therapy, or one of the cores of therapy, I don't want to say the core in general, but one of the cores of therapy really is that you have just an unconditional positive regard for your client. That's what it's known as. I don't want to use lipstick. Haha. An unconditional positive regard, it essentially boils down to you generally believe and think well of the person that you're working with. You like them more or less, and not like as in like, oh, I'm going to be buddies with you, but like as in that you think at their heart they're a good person, and you like them in general, and they might do things that you can see are unhealthy or that you disagree with, but them doing things does not define them to you. And I'm of the belief, and I think there's other clinicians too who would agree with me, that at the core, that really does make a big difference in counseling, because you can have all the theories and techniques and practice in the world, but if you don't think well of your client, if you don't have that unconditional positive regard for them, they tend to sense that, and it can really hurt the therapeutic relationship. So I think in that regard, a lot of us do the best we can even if we don't have all the techniques, and that just comes from learning, or even this, like, you know, emotionally focused counseling. Like, yeah, I can look back and see how it would have probably greatly improved some of my prior clinical experiences with people. However, all I can do going forward is say, like, okay, now I know. And it's not necessarily like it's the end-all be-all of theories either. You know, there's something like cognitive behavioral therapy can be extremely effective, and may or may not have as much to do with attachment per se. Not to say it can't, but when you look through a CBT book, it doesn't necessarily bring up a whole lot of attachment. It's not the main focus. And shucks, how'd that happen? That's weird. Haha. So, but anyway, so some clients may not necessarily respond as much to something like that. They might be looking for something very more CBT oriented, and I think at the end of the day, it's also recognizing that it's just another tool in your tool belt as a clinician of how you can help people grow. So, speaking of therapy and counseling and stuff like that, I had a small anxiety attack of sorts a few days ago. I think it was maybe Tuesday. I think it might have been a Tuesday. Anyway, I came to the realization that I miscounted when I was initially starting this. I don't know how. I counted everything out, and I don't know if my brain just wasn't working or what, but I was really looking at this pattern, and I had this realization of, like, I don't think this is gonna fit. It was a horrible moment, and what I ended up doing was sitting down and counting it all out again, and I'm literally like just 5 rows of fabric away from being off of it entirely. So and I'm not just, God was good that he didn't let me completely botch this, because to have gone that far and then essentially not having more space left, I think would have been way too tragic for me to endure. I would have called my friend just like crying and be like, I ruined your birthday present. Oh gosh. But so no, it'll fit fine. I'm not really worried about that bottom being so close, just because of the fact that there's sort of like this like sticky melting matte stuff that you can put these on, and I'll use that, and I'm not really worried about being so close to the edge. I've seen some things that say, like, no, you have to have at least 2 inches, and that's what I had been aiming for, but I can make it work. I'm not worried. And I mean, in general, it's kind of strange because things are returning to normal, but not really normal still, so it's very odd around here. But because there's things that are opening up, and things that aren't open yet. I'm not gonna lie, I really miss my makeup stores. I miss going to Sephora and oohing and awing at the different makeup that they had. I'm really looking forward to when those open up again. But in general, it's nice that things are returning to some level of, not normal, I guess, because probably things will never be normal really again, at least not for a long, long time. However, things are returning to a state where we can go out and maybe visit friends and do things again. We're technically allowed to be in groups of less than 10 again, I think. And so my close friend who lives here, I was gonna maybe go spend time with her, because she has this really wonderful front deck, and we'll sometimes get together and do yoga on the front deck together, and then sit and have coffee and chat for like hours. And I was gonna visit her, but then her spouse caught a fever, so he went to get tested for the virus, and they tested him for the flu as well. And he's already gone a few days without being feverish, but we're still waiting on the test results. But just in consideration for that and the fact that like my parents do live with me and they're older, we chose to continue to postpone getting together, and just to make sure that everyone's as well as they can be, because we don't want to accidentally spread anything. So, but it was hard. I was really looking forward to seeing her. We really miss each other's company. I miss hanging out with her. She's a really wonderful person, like a really excellent, kind of like a spiritual guide, sometimes, where I can talk about spiritual issues with her, and she's very wise for her years. So it's nice when you can find friends who are able to listen to you on kind of those levels. And all friends listen on different levels too. I mean, I think I talk with clients sometimes because I think sometimes clients want to find that perfect friend, and not to say there's not a perfect friend, but I think there's also the reality that relationships are complex, and some friends you can talk about certain things with, and some friends maybe it's just not their interest or their thing. So, and it's not from lack of love for you, but I have friends that I can talk about spiritual stuff with, and I have friends who I can't really talk about spiritual stuff with, but we talk about all sorts of other fun stuff too. Creative things, or society in general, or hopes and dreams and goals. And at the end of the day, it's another round of like, we all just want what's best for each other because we love each other so much. So, and then this week I think it's scheduled to be pretty busy. It'll be interesting to see what happens. Sometimes you have weeks where everyone shows up to their slots, and then sometimes you have weeks where there's just a bunch of people who cancel, or there's a bunch of no call, no shows, and you're ultimately trying to scramble to figure out how to get it all in, or how to fill those holes back up. Kind of frustrating. I would say though usually people have pretty valid reasons. I've only had a few clients where they'd give me this reason for not coming to their appointment or cancel last minute, and I'm like, no, that's shenanigans. So those boundaries can be interesting in counseling. I really enjoy boundaries in the counseling setting, because it's precarious, because it's still uncomfortable sometimes. Because there's sometimes this desire in you of like, you want to be liked, and I think that's a normal human desire. And so there's this fear of like, oh no, if I set a boundary, like, are they not going to like me anymore? Are they going to stop coming back? And after a while, you learn to stop fearing that way. Because as a clinician, you're supposed to be modeling what healthy boundaries look like, and sometimes people don't like that, and that's okay, because it's potentially due to stuff that they experienced, in previous years of their life or in previous relationships, and so it's okay when there's pushback. Again, as a clinician, you just want to have that unconditional positive regard for them, where they can give a pushback, and yet they know that you still think well of them as a person. Because again, you can disagree with somebody and still care about them or think well of them. So I think the boundaries are so important in that way. This has definitely been a boundary talk kind of session. But I'm looking forward to kind of getting through this piece. I have a few others that I'm looking forward to starting, but I really want to finish this one before I get into anything else too soon. Just so I can make sure my battery's doing okay. Yeah. But yeah, just so I can make sure that at its core this piece can be finished. And I don't find something else enjoyable to do, but then this sits around for potentially a year or something on accident. That would not be great. I would not like that. That's what happened with my mother's piece a lot. Which we have it framed. It is up in our living room. It's very pretty up there. We found a really great frame at Hobby Lobby. So it looks beautiful. I'm excited to add a few more pieces around it. I'm looking forward to at some point starting Contessa with a squid. I don't know where I'll put her when I'm done with her, because she might look a little odd next to all the marrying pieces. So not that, you know, she's not lovely, she's lovely, but I don't know how I would feel about having this almost eldritch horror kind of lady next to the Virgin Mary. I don't know. Maybe they go together, maybe they don't. Let me know your thoughts. What do you think? Comment down below. That's one thing about YouTube that's been new for me too, is I never really, never used to comment much on people's stuff, because I always felt like nobody would much care what I had to say anyway, and I have found myself allowing myself to comment more on people's stuff. Not a ton, but a little bit. And I think just the realization of like, oh, like, I would like comments. Comments would be nice. And I haven't really encountered any stupid quote-unquote comments yet, and I always worry that maybe mine would be silly or stupid and they wouldn't really care about what I had to say. And so I think being in the position now where I realize, like, no, I would like to hear what people have to say, and so I think it's safe to say that there's probably people who would like to hear what I have to say too, and that's okay. So I've been commenting a little bit more on YouTube. And I have an earworm. I have like a song stuck in my head. It's from the soundtrack of Beastars. I don't know how many of you have had the luxury of listening to it or watching the show. I didn't want to watch the show originally because I was like, I don't know, this looks kind of weird, but I have really enjoyed it. And I got my friend Teresa into watching it too, which has been funny because when she first saw it, she had the same reaction as me, where she was like, I don't know about this. And I was telling her, like, no, it's really actually quite good. It's this really cool commentary in a way on society, and yet it's just also a really good story, and the characters are great, and the voice acting is great, and the music. The music. Sometimes I enjoy putting on Stitch with Me's in the background, or I listen to other commentators on YouTube. Like, I listen to Dr. Grande or Psychology in Seattle. I really enjoy Psychology in Seattle. That was what got me interested in emotionally focused therapy. Dr. Honda, because he approaches it from this emotional therapy perspective when he's analyzing these relationships in it's going to be all the way over here. I'm not going to be able to count that out well, so I'm just going to rewrap you and tuck you off to the side until later, because I don't want to mess it up. I don't want to do that. So spare is 3848. Yeah. Oh, it's right here. Ha! I left it right here. Silly. Anyway, yeah, Dr. Honda will comment on the couples in 90 Day Fiancé, and I really enjoy listening to him. He's got so much of interest to say, and so that got me interested in emotionally focused therapy. But what I also do sometimes is, when I'm not listening to Stitches, or if I just get tired of hearing people's voices, I usually end up putting on the Beastar soundtrack, because the music is just so good. It's so good. It's jazzy and orchestra, and it's beautiful. I absolutely love it. So, but anyway, I'm gonna stop this video here, and I hope all of you have just a wonderful day. I keep you in my prayers, and keep me in your prayers too. So, and I'll see you guys all later. Bye.